For more than 1 million uninsured Texans ineligible for coverage under the Affordable Care Act or Medicaid, routine care is defined as costly trips to the emergency room, where taxpayers often pick up the bill.
The situation today is unsustainable, and it's a big concern.
Uncompensated care costs Texas hospitals about $5.5 billion each year, according to the Texas Hospital Association. University Health System in San Antonio shares that financial burden, but not as much as it once did. In the mid-1990s, the hospital developed CareLink, a financial assistance program for poor, uninsured Bexar County residents that allows them to make monthly medical bill payments on a sliding fee scale.
It all of a sudden becomes manageable. And the best part of it is that when you get the CareLink membership, you also have a primary care physician.
Because of CareLink, the system now collects an average of $18 million a year in co-payments and deductibles, money it would otherwise not receive. The program has the makings of a Texas solution that could appeal to the Republican leadership, cost sharing and a focus on preventative health. But without a tie to Medicaid, there is little to no chance of drawing down what the left-leaning Center for Public Policy Priorities estimates could be as much as $8 billion in federal assistance a year.
It's a huge fiscal issue.
John Hawkins with the Texas Hospital Association says its #1 priority in the 84th Legislature is for lawmakers to grant state health officials permission to negotiate with the federal government to find a Texas way of providing affordable access to care through Medicaid, thus making that solution eligible for federal dollars, a goal that fell short in the 83rd.
I think one of the challenges we had last session was that we didn't have some good examples of other states that have had alternative successes. It was really early. Certainly Arkansas was really the first success story.
Now enough time has passed to see how those state-specific plans are working or not working, as we saw recently in Arkansas with its plan costing the state more in its first year than expected.
It is more of an issue for the legislature to give our Health and Human Services Commissioner some broad parameters with which to enter into a negotiation with the federal government.
Despite recommendations from the Senate Health and Human Services Committee to find a way to expand care, and the new governor saying he's open to ideas, it'll be a question of political will on the part of the Republican-led legislature to strike a deal with the Obama administration. In San Antonio, this is Alana Rocha reporting for the Texas Tribune.